colon cancer, warning signs and symptoms that you should never ignore. I knew something was terribly wrong when I saw the blood in the toilet bowl that morning, recalls Michael Thompson, his voice trembling as he recounts the moment that changed his life forever. But, like many men my age, I convinced myself it was just hemorrhoids and went about my day. That decision nearly cost me my life. At just 45 years old, Michael was one of the estimated 153,000 Americans diagnosed with colorectal cancer in 2023, a staggering number that continues to rise, particularly among younger adults. What makes his story particularly haunting is that, like thousands of others, his early warning signs were dismissed, both by himself and initially by healthcare providers. The American Cancer Society reports a disturbing trend. Colorectal cancer rates have increased by 2% each year among adults younger than 50 since the mid-1990s. More alarming still, nearly 60% of patients diagnosed before age 50 are already at advanced stages when the cancer is discovered. These aren't just statistics. They represent real people, real families, and real tragedies that could often be prevented with earlier detection. Michael's story began with what seemed like ordinary digestive issues. I started noticing changes in my bowel habits about 8 months before my diagnosis. Sometimes I'd be constipated for days, then suddenly have diarrhea. I blamed it on stress at work, my diet, anything but cancer. As weeks turned into months, new symptoms emerged. He experienced unexplained fatigue that coffee couldn't fix, occasional cramping in his lower abdomen, and mysterious weight loss despite eating normally. I lost about 15 pounds without trying. At first, I was actually pleased. Who doesn't want to lose a few pounds? I had no idea this weight loss was my body's desperate warning signal. Dr. James Martinez, a leading gastroenterologist at Memorial Cancer Center, explains why these symptoms are so crucial to recognize. The tragedy of colorectal cancer is that it's one of the most preventable and treatable cancers when caught early, but its warning signs are often confused with common digestive issues. This leads to delayed diagnosis and worse outcomes. The turning point in Michael's story came when the blood in his stool became impossible to ignore, accompanied by severe abdominal pain that wouldn't subside. His first visit to urgent care resulted in a diagnosis of hemorrhoids and irritable bowel syndrome, or IBS. This highlights a critical issue in colorectal cancer diagnosis, the similarity of its symptoms to other, less serious conditions. Let's explore these look-alike conditions that often mask colorectal cancer. Inflammatory bowel disease, or IBD. Like colorectal cancer, IBD can cause bleeding, diarrhea, and abdominal pain. However, IBD typically shows inflammatory markers in blood tests and responds to specific treatments. Irritable bowel syndrome, IBS. While IBS shares symptoms like changes in bowel habits and abdominal pain, it doesn't cause bleeding or weight loss. This was a crucial missed distinction in Michael's case. Hemorrhoids. Though they can cause rectal bleeding, hemorrhoids typically cause bright red blood that appears on toilet paper, not the darker blood mixed with stool that Michael experienced. Diverticulitis. This condition can mimic cancer symptoms with abdominal pain and bleeding, but imaging tests can usually distinguish between the two. Celiac disease. While it can cause weight loss and digestive issues, celiac disease doesn't typically cause the persistent bleeding Michael experienced. After 2 months of worsening symptoms, Michael sought a second opinion. This time, his doctor ordered a colonoscopy, the gold standard for colorectal cancer detection. The procedure revealed a large tumor in his sigmoid colon, and subsequent staging showed it had reached stage 3, spreading to nearby lymph nodes. When they told me it was cancer, my whole world stopped. Maybe missing crucial early warning signs, particularly in younger patients. Michael's treatment journey was intense. Surgery to remove the tumor, followed by 6 months of chemotherapy. The side effects were brutal: nausea, fatigue, neuropathy, but he fought through each day, motivated by his family's love and support. Today, 2 years after his diagnosis, Michael is cancer-free, but forever changed. "I've become an advocate for listening to your body," he says. "If something doesn't feel right, don't wait. Don't let anyone dismiss your concerns." For viewers watching this video, here are the warning signs you should never ignore. Persistent changes in bowel habits lasting more than a few weeks, unexplained weight loss, blood in or on your stool, abdominal pain or cramping that doesn't go away, fatigue that rest doesn't improve, and feeling like you can't empty your bowels completely. Prevention remains the best defense. Current guidelines recommend regular screening, starting at age 45, for average-risk adults, but those with family history or concerning symptoms should consult their healthcare provider about earlier screening. A healthy diet rich in fiber, regular exercise, limiting alcohol consumption, and avoiding tobacco can all help reduce your risk. Dr. Martinez emphasizes, "What makes Michael's story particularly important is that it highlights how colorectal cancer doesn't discriminate by age. The symptoms he experienced, changes in bowel habits, unexplained weight loss, blood and stool, these are red flags at any age that warrant immediate medical attention." Michael concludes with a message of hope and urgency. "Cancer showed me how precious every day is, but my story didn't have to include cancer. If I'd paid attention to those early warning signs, if I'd pushed harder for answers when things first changed, my journey might have been very different. Don't wait until you're certain something's wrong. By then, it might be too late." Remember, colorectal cancer is one of the most preventable cancers when caught early. Don't let fear or embarrassment keep you from talking to your doctor about concerning symptoms. Your life and your family's future may depend on it.